lawyer, it's the Attorney General of the state of New York who interprets the law. That's how the law works, sir.
I now recognize the ranking member, Dr. Ruiz from California, for 5 minutes of questions.
Thank you, Mr. Chairman. Something I believe every member of the Select Subcommittee would agree on is the obligation that every public official has to be transparent with the American people, especially during a public health crisis. Transparency, including with public health data, is necessary for public trust, and it's expected of those who hold elected office. What's more accurate and comprehensive data is critical to develop forward-looking policies to prevent and prepare for future pandemics. As an emergency physician, I know firsthand that when dealing with a new and evolving public health crisis, every piece of data can help build a better picture of what we are facing and inform better decisions. Governor Cuomo, I appreciate your voluntary participation in today's hearing, as well as your cooperation with the Select Subcommittee in recent months. After reviewing nearly 200,000 pages of documents and conducting 10 closed-door interviews, questions still remain regarding the extent of which your administration was transparent in reporting nursing home fatality data, both with respect to the daily numbers and the numbers included in the July 6, 2020 New York State Department of Health report. As an initial matter, let's talk generally about your administration's public reporting of COVID-19 related deaths. So, Governor Cuomo, your administration publicly reported COVID-19 related deaths with a fatality tracker available on a public website, correct?
Yes, sir.
Okay. The New York State Department of Health also posted a daily report specific to nursing home deaths on a publicly available webpage, right?
I don't know specifically what the Department of Health had separately.
Okay. Initially, the nursing home fatality data included deaths both in facility and out of facility, meaning in the nursing homes or nursing home patients who were moved out of the facility to a hospital, for instance. However, in early May 2020, this reporting changed to only in-facility deaths. Was this change your decision?
No, sir.
Whose decision was it?
I don't know.
This change obviously made the reported number of nursing home-related deaths lower. Do you know if that was the reason for changing the reporting?
No, if I may, Doctor. Every day, I personally did a daily briefing and reported the number of deaths. The surest place with the most certainty was this is the place where they died. Every night we got a census from the hospitals. Every night we got a census from the nursing homes. Total nursing home deaths, total hospital deaths. I had confidence in those numbers. As the Republicans started this nursing home scandal theory, there were more requests for more subcategories. At-home deaths, probable deaths, presumed deaths, in facility, out of facility. And dealing with those subcategories, the numbers were less than certain and they were highly problematic because you were calling up a nursing home and basically asking them to do a forensic audit in the middle of a pandemic. Please track this patient. They went from the nursing home to home, and what happened? They went from the nursing home to the hospital. Can you find out what happened? The confidence level in the out-of-facility deaths or presumed deaths was very weak and very low. It was very important to me that whatever I said, I knew was accurate. They asked for out-of-facility deaths. They asked for presumed deaths. I said, when we have accurate numbers, I will release them. But I'm not going to release numbers that I don't believe and we have reason to believe were false. And there was a lot of double counting and a lot of mistakes in those numbers. And Doctor, my briefings attracted people because they got the truth. And Whereas President Trump would say a different thing every day, I only said what I knew to be a fact. And I was not going to put out a number unless I knew it was true. I said I was not putting out the out-of-facility deaths until I knew they were true, but the total number was unchanged. In other words, the out-of-facility deaths would have just reallocated deaths from hospitals to nursing homes and reduced the hospital number. But the total death number was exactly the same.
So the daily reporting was not the only way the New York State Department of Health shared nursing home fatality death with its public. There was a report released on July 6, 2020 that purported to be an in-depth analysis of nursing home data. During the past several months of transcribed interviews, Select Subcommittee staff heard from multiple witnesses that this report started off as a data-driven scholarly article with work from several Department of Health employees. But prior to its release, decisions were made by members of your executive chamber who were not public health experts to change the numbers in this report. Again, the changes made lowered the number of nursing home-related fatalities included in the report. So were you aware of the fact that there were seemingly two versions of what was released as the July 6, 2020 New York State Department Health Report?
Yeah, the purpose of the July 6th report was not to do a scholarly article for a medical journal. We were in the middle of a pandemic. And there may have been people who wanted to do a scholarly article for a medical journal, but this had a much more practical purpose. We're in the middle of a pandemic. How was COVID getting into the nursing homes? That was the question. How was COVID getting into the nursing homes? And that was the purpose of the report. There were multiple sets of numbers because the numbers kept changing because the nursing homes were under tremendous pressure, and this was a tremendous accounting task that we were asking them to do. The report used the verified numbers, and I said, because this was a question every day, doctor, this was not like surreptitious. I said, when we have the out-of-facility numbers that we believe are accurate, we will release them. They were not in the July 6th report. The health commissioner said he had the verified numbers, there were unverified numbers. They both backed the same conclusion in the report, so he decided to use the verified numbers, and we said when we audit the unverified numbers, we will release them. So it was everyone was always clear. Here's the total death. Here are the subcategories that we feel confident about. Here's what we don't feel confident about. Also, this was very political at the time. President Trump was accusing me of overcounting the number. He said I was inflating the number to make him look bad, that there were actually fewer deaths, and I was inflating the number. So it's ironic that now the accusation is, oh no, you were undercounting the number, right? So you have to pick it at one point.
So let me just ask you directly, and let me remind you that you are under oath, Governor. Did you direct your staff to make the number of nursing home-related fatalities lower than they actually were?
No, we said these are the numbers without the out-of-facility death numbers, which we will add when they're accurate, which will reduce the hospital count number, but the total death number stays exactly the same. It was an allocation question. Do you allocate the death to the nursing home, or do you allocate it to the hospital? But the total death number was the same. And the only reason the Republicans were asking these questions about nursing home deaths was to further their conspiracy theory that there were massive deaths in nursing homes, which in my opinion was a pure diversion from the federal malpractice that was going on. because everybody knows that COVID did not get into nursing homes from admissions or readmissions. It came in from community spread. And the reason why you had so many infected staff workers going to work was because the federal government had no PPE, no masks, no equipment, no warning, no preparation. We had a president who lied to us from day one.
As ranking member of the Select Subcommittee, I'm committed to following the facts for an objective analysis of how COVID-19 impacted our communities across the country, all with the goal of putting us on stronger footing to prevent and prepare for future pandemics. As I said, accurate and complete data is vital to ensuring that we as a country are as prepared as possible to handle the next pandemic better than the last. And with that, I yield back.
I now recognize the chairman of the full committee, Mr. Comer from Kentucky, for 5 minutes of questions.
Thank you. Governor Cuomo, do you stand by the March 25th,